National Mental Health Program. This was launched by Government of India in 1982 to address the growing burden of mental illness and the shortage of mental health services. So it remains the cornerstone of India's mental health policy, aiming to integrate mental health into general healthcare, reduce stigma, and ensure accessible services for all. If we talk of its background, the launch year was 1982, and it was launched by Ministry of Health and Family Welfare. High prevalence of mental disorders were being reported, but there was lack of awareness, there was a stigma, and there was inadequate infrastructure, which propelled the ministry to launch this program. In 1996, district mental health program was introduced based on Bellary model, which is the model based in Karnataka. In 2003, modernization of state mental hospitals and strengthening the psychiatric wings in medical colleges were done so that the mental health issues can be addressed comprehensively. Further strengthening was done in 2009, where different manpower development schemes were added to train psychiatrists. There were clinical psychologists, psychiatric social workers, and psychiatric nurses. There was a legislative link also, that is Mental Healthcare Act 2017, which reinforced NMHPP objectives by establishing a rights based framework, decriminalizing suicide, and mandating affordable access to mental health services. So, what are the objectives of this program? To ensure availability and accessibility of minimum mental health care for all, especially the vulnerable group, integrate mental health knowledge into general healthcare and social development, promote community participation, develop human resources in psychiatry and allied disciplines, and reduce stigma and increase awareness through IEC campaigns. The key components of this program is number one, district mental health program. Now, what is DMHP? How does it work? It has certain working schedules, or you can say the working activities, like early detection and treatment of mental illness, training of general physicians and healthcare workers, IEC activities, school mental health programs are run, suicide prevention services are given, and rehabilitation for chronic mental illnesses provided. The mental hospitals are modernized, upgrading their infrastructure, equipment, and services, and converting custodial institutions into therapeutic centers. Then, psychiatric wings are upgraded, and they are now developed in all medical colleges and general hospitals also. Manpower development is being done, and the centers are being established for psychiatry, clinical psychology, and psychiatric nursing. Community based rehabilitation, we have vocational training, halfway homes, support groups, and we have NGO involvement also. So, the achievements till now, DMHP expanded to hundreds of districts across India, awareness has increased, stigma has been reduced, and this was all possible through various IC campaigns. We have integration of mental health services into primary healthcare. We have strengthened psychiatric wings in medical colleges, and human resource has been developed in psychiatry and various allied fields. But still, we are facing some challenges, like there is shortage of trained mental health professionals. We have uneven distribution of services across states. There is stigma, though it has been reduced, but still it persists. There is lack of awareness. We have limited budget allocation, and there is weak monitoring and evaluation system. So, what are the future directions that are proposed? That the digital mental health platforms should be expanded, the school mental health programs should be strengthened. We should have intensified suicide prevention strategies. We should address substance use disorders under NMHPP, and the greater investment in research and innovation should be done. So, this was all about your mental health program.